Y'all ready for this? On Thursday, the Centers for Disease Control and Prevention (CDC) website had a new statement: if you are fully vaccinated, you can resume activities that you did prior to the pandemic. So assuming that you are not Deadpool or the Lone Ranger, fully vaccinated people can resume activities without wearing a mask or physically distancing, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local business and workplace guidance. So starting now, get ready to see more people without face masks on and moving within 6 feet or 1 Denzel, because Denzel Washington is about 6 feet tall, of each other. While some are celebrating this change, others are wondering whether the new guidelines are too unlimited, so to speak, too soon. In other words, is this a case premature relaxation? After all, according to the New York Times, the US still had over 35,000 new reported COVID-19 cases on Wednesday. Over 35,000 is nowhere close to zero unless you happen to be living in -35,000 land. The severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, is still spreading, and so are more contagious variants of the virus. Nonetheless, the CDC seems to be changing its stance for 3 main reasons. The first is the COVID-19 vaccine. In a White House press briefing, CDC Director Rochelle Walensky, MD, cited numerous reports in the literature that demonstrate the safety and real-world effectiveness of the authorized vaccines. After a rocky start in late 2020, as in a hit your head repeatedly with a rock start, the COVID-19 vaccination program has really picked up since late January, with 35.8% of the total US population now fully vaccinated and 46.6% having received at least 1 dose, according to the CDC COVID-19 vaccine tracker. That's not the 75% or so needed to reach herd immunity thresholds yet. But it may already be slowing the virus. After a surge in cases during the winter, the number of new COVID-19 cases and resulting hospitalizations and deaths has been trending downwards. Scientists have credited the vaccination program for bringing down these numbers, at least in part, although rising temperatures and humidity could be helping to some degree as well. The second reason is the unvaccinated. Early on, COVID-19 vaccines seemed as difficult to get as toilet paper was last year. However, now the rollout seems to have reached an inflection point, with vaccination rates slowing significantly. Those not yet vaccinated include people who may not have ready access to current vaccination sites due to distance, schedule issues, and other barriers. But they also include people who are considered vaccine hesitant, who may be reluctant to get the vaccine for a range of reasons. Of course, some of these folks are in that never ever gonna get it crowd. But some may just need a little more incentive.